Currently, oral cancer is the 6th common cancer in the world, with 650,000 cases reported annually, of which 350,000 deaths are reported. We are particularly working on oral cancer detection. It's quite hard to detect in early stages. The state of the art is tissue biopsy, which is painful and invasive and is not so suited for large-scale screening. We are developing novel functional hydrogels that we can use to capture proteins. Our vision is to implement this hydrogel technology as a lollipop so that individuals can suck on the lollipop, which allows us to collect proteins from saliva samples, which we can then detect much more easily. I believe that our solution would be a much kinder and much more efficient way of detecting oral cancer in early stages. Protein biomarkers in saliva, they are present in very low concentration, so it is very hard to detect them. Using our hydrogels, we can increase the concentration of the proteins in the gel, so they are permanently captured by our gel. Once we have concentrated proteins, we can shine light on our gels, and this causes proteins to release from the gel, and they get automatically labeled with fluorophores. So we can then put these concentrated and labeled proteins in antibody-coated plates, and we can then measure fluorescence to know the concentration of proteins in the saliva samples. In addition, saliva also contains lots of other proteins. So our hydrogel acts like a net. It prevents those proteins, those unwanted proteins, from entering our gel and only captures the proteins of interest. There are currently no products in the market on lollipops to do saliva detection. All of the hydrogel technology has been developed in my labs. We have been in discussions with academics in the School of Dentistry, and we are looking to source saliva samples from there. So at University of Birmingham, we have a perfect ecosystem to work with correct people at different stages of this project. We are not only doing work on diagnostics of cancer, but equally on treatment of cancer as well.
My name's Professor Jason Parsons. I lead a research team which is exploring the impact of different radiotherapy types on tumour models, with a particular focus on head, neck and brain cancers. So the major problem is cancer patients, when they go through radiotherapy treatment, they frequently have adverse side effects as part of conventional X-ray treatment. Also, some tumours, particularly of head, neck and brain, are very resistant to the treatment, so we need more effective options, but also safer options for those patients. Approximately 50% of all cancer patients worldwide will get some form of radiotherapy treatment. About 850,000 patients will get a diagnosis of head and neck cancer, and approximately half of those will die as part of the cancer itself. So we really need to optimize some of the treatments that we use for these patients. A lot of cancer patients will go through a lot of adverse treatment side effects, particularly with conventional X-rays. There's more novel technologies, so proton beam therapy, for example, has been introduced over the last few decades. Evolving some of those treatments, it's a safer treatment option. We can deliver most of the radiation dose to the tumour. This spares the normal tissues, and then we get the reduction in the adverse side effects. At the University of Birmingham, we have two key accelerators that are able to deliver alternative radiotherapy types, and this is where we're trying to advance some of the research into these to make them more available to patients in the future. At the moment, we've done a lot of research into proton beam therapy, so whilst we know it's a more targeted treatment, there are some differences in the physics and biology of proton beam therapy compared to conventional X-rays. We've revealed some new knowledge about how protons interact with molecules such as DNA, how it damages the DNA. We've started to lead on some of the combinations of proton beam therapy with drugs to lead to an exacerbated effect. Boron neutron capture therapy, or BNCT, involves uptake of a boron compound into tumour cells. The way we do that is we attach boron to another compound. In this case, most clinically used is an amino acid called phenylalanine. And once we attach it to that, it's then uptaken by an amino acid transporter called LAT1. The tumor cells essentially soak the boron compound up, and then once we irradiate with neutrons, this breaks down the boron, generates these very densely ionizing particles, which then kill specifically the tumor cells. This is the only neutron accelerator in the UK. We have a lot of medical technology that's present in the University of Birmingham. We couldn't do the research anywhere else because all the infrastructure, all the partnership, all the collaborative people that are available here is only present in Birmingham and not elsewhere.
So as we know that currently the resources are limited for NHS, and the clinicians and GPs, they are stretched to their capacity. So anything we can do to ease that stretch, I think could be a game changing for NHS. If we are successful in our lollipop diagnostics technique, then people can use this technology at home at their own convenience. We are looking to optimize our hydrogel lollipops using human saliva samples. So in particular, we will work to reduce the protein capture time that determines how long someone has to put a lollipop in their mouth. We want to be able to measure proteins that are present in even earlier stages of cancer.
Our vision is to select the optimal radiotherapy treatment for a particular patient with a certain disease, and we know that that treatment would be effective, but also it would limit some of the side effects that they go through and experience, and they have a longer term outcome and survival as a course of that treatment. We're part of a Cancer Research UK Radiation Research Network Centre of Excellence, or RadNet Centre. We have a strong collaboration with AstraZeneca, which we're using some targeted drugs and inhibitors which ultimately prevent the tumour cells from repairing their DNA. And so we can use those drugs in combination with proton beam therapy to exacerbate some of the effects of the radiation. The University of Birmingham is world leading in these effects. We have both the technology, we have the skills, we have the expertise in the infrastructure to deliver on some of the radiotherapy research that we're investigating.